welcome to our lesson on the reproductive system. This is going to be a combined lesson in which we do a virtual dissection as well as an informational session on the functions of the system. Our goals, well, when we're complete, you should be able to identify each structure on a model, describe the purpose of the reproductive system as a whole, explain how each structure accomplishes those purposes, identify any possible challenges to the system, such as outside challenges, discuss how all of those structures are going to help to maintain that homeostasis. And basically, we're going to be utilizing biodigital to dissect and label, and our labels are going to include both the name as well as the function of the system as described earlier. The purpose is to reproduce offspring, obviously. It is the only system that does not become active until puberty, so somewhere around 11 to 16 years old. The primary organs are the gonads, or the ovaries and testes, male and female respectively. The gonads are what's responsible for producing all those gametes, or the sex cells. For instance, in males it would be sperm, and in females eggs. And they're also going to be responsible for secreting hormones such as estrogen, progesterone, and testosterone. Now, the accessory organs, they're going to function to deliver the sperm into the female, and within the female, that's where fertilization will take place, as well as the growth and development of the fetus. Here's an image of the female reproductive system. It is a mid-sagittal section, so it's going to allow us to be able to look at the inside of the female reproductive system. Biodigital doesn't allow you to do this. We're basically going to be looking at the surface anatomy of each structure. So in this image, I want you to note that it includes the urinary bladder, which is not technically part of the female reproductive system. It's part of the urinary system, so we're not going to see that in biodigital. Here's a list of the structures that we'll be looking for in the female reproductive system. Now, some of them, because they are technically part of the integumentary system, we're not going to be able to see them directly, but we'll do our best to label where they would be. Okay, once you've logged on to Biodigital, click on the Explore menu, scroll on down to find Anatomy by System, look for the female reproductive. To dissect and label, we're going to click on Edit in Studio at the top left. To see our list of structures, click on Anatomy menu at the top left. Expand the Reproductive drop-down menu. Reproductive system is broken down into the external genitalia, internal genitalia, and breasts. Our attention will focus primarily on the genitalia, but the breasts are part of the female reproductive system. This is the site for milk production. In fact, the breasts, or the mammary glands, are a characteristic shared by all mammals. We will now focus on the external genitalia. So go ahead and drop down the menu for that. Now, I want you to note that because some of these structures are considered part of the integumentary system, we will not be able to label them here. So just follow along as best as you can. I'll show you some of the other images so you can get a sense of where these structures are and what their function is. We just won't be able to label it here today. Specifically, the two structures we will not be able to label here is the mons pubis and the labia majora. The mons pubis is a fatty tissue that's sitting right in front of the pubic bone. It's going to help provide cushion so that way the bone is protected. And the labia majora, well, labia means lips, so majora meaning the larger of the lips, and it's the most external. It's composed of keratinized stratified epithelium. It's going to provide a water barrier, and essentially it's analogous to a scrotum. Now go to the left-hand menu, and underneath the external genitalia, you'll find the labia minora. You'll see that once you've clicked on it, it will be highlighted within the structure. This is the internal layer of lips. It is not dry to the touch, and therefore it will contain lots of sebaceous glands that produce sebum to help prevent water loss and protect it from bacterial infection. You'll find that it also has no hair follicles, and it's essentially synonymous with the skin that covers the penis. Now select the clitoris from the left-hand menu. You'll notice the yellow highlighted structure sits just superior to the labia minora. This tissue is highly sensitive and contains many sensory nerve endings. It also is vascular and can become engorged with blood. It is analogous to the corpus spongiosum and cavernosum of the penis. In fact, during early development, the penis is actually formed from the structures that form the clitoris in females. Now go to the left-hand menu and select the internal genitalia. From the left-hand menu, select the vagina. You'll notice highlighted in yellow a narrow lumen or tube that extends in length about 3 to 4 inches from the vaginal opening up to the cervix. The vagina is composed of folded muscle, smooth muscle layer that will extend or expand 10 times its width during birth of a baby. The environment is slightly acidic to help protect it from any bacterial infection. This can actually be harmful for the sperm. So within semen will contain a compound that will help to neutralize the acidity so the sperm are not harmed. At the vaginal opening, there is a thin mucosal lining or layer that is called a hymen. It's not present in all women, but it will become ruptured once they have their first menstrual cycle or sexual intercourse. We are now going to move up to the uterus, which is composed of the cervix and the uterus body. Because the uterus dips into the vagina, you will need to click on the 3 buttons on the uterus label and hit the isolation tab. On the most inferior end of the uterus contains a narrow outlet known as the cervix. The cervix secretes a mucus forming a plug which prevents vaginal bacteria and sperm, which could potentially carry harmful bacteria with it, from entering into the uterus. Once an egg is released during ovulation, the mucus plug will begin to thin. There's also components within the semen that will help to thin out that mucus plug to allow sperm to enter more easily. During labor, the walls of the cervix begin to thin and then dilate to allow for the passage of the baby. Cervical cancer is a common medical concern, specifically for those between the ages of 30 to 50. Those that are sexually active have a higher risk due to an increase in inflammation of the cervix due to multiple pregnancies, as well as the potential risk for STIs, such as HPV or human papillomavirus. Routine pap smears is the most effective way to detect cervical cancer. Early treatment usually have a high success rate of curing. Treatments might include surgical removal or chemical radiation, both of which run the risk of not being able to have a baby or carrying a baby to term. Now back to our model. Go over to the left-hand menu and we need to click on the eye icon next to each of the structures that have the visual turned off, so that way we can see the rest of the anatomy. Now I'm going to jump up to the ovary. Don't worry about the other labels, we will get to those. So the ovary is contained on both sides of the uterus. They are about 2 times the size of almonds, and this is the site where our eggs are produced and stored. Now, a female will be born with all the eggs she'll ever have. They're basically just staying there in an immature state, sort of in hibernation. Now, once a girl reaches puberty, she'll have her very first ovulation. This is known as menarche, okay? So during that process, the egg will begin to develop, just one of them. And then by the time she reaches about day 14 of that cycle, that egg will get released and it'll get carried into the fallopian tube, and this is where fertilization is going to take place. We'll take a look at this in a moment. Now there's actually a gap between the ovary and the fallopian tube, so there are these little finger-like projections at the end of the fallopian tube that are called fimbria. So they're just going to kind of scoop it up and bring it into the fallopian tube. And at the sort of the apex of the fallopian tube is what's known as the ampulla. Now specifically, it's the ampulla where fertilization must take place. Now onto the fallopian tube. It is a narrow tube that extends from the superior portion of the uterus, both left and right corners, all the way to each of the ovaries. It is made of a smooth muscle lining that helps to contract and move the egg forward. It's also lined with ciliated epithelium, which will also help to propel the oocyte or the egg forward. It is the site where the sperm is going to meet and fertilize that egg. It is also the site for the first few cell divisions. In fact, the timing of fertilization is so critical that if the sperm does not fertilize that egg post-ovulation within a day or two, there's a good chance that that egg will be eliminated during a menstrual cycle. Once fertilization takes place, that fertilized egg is going to need to implant itself into the uterus where it will continue its development. The body of the uterus sits just above the cervix. The body of the uterus is the site for embryonic and fetal development. It is highly vascularized, which means that it has a lot of blood vessel to provide nutrients not only for the organ but for the growing fetus. The uterus is composed of 3 layers. The periometrium forms the outer serous membrane. The myometrium is a thick, smooth muscle layer which is responsible for contractions during delivery. The endometrium is the innermost lining. It's the site for implantation. It's also going to give rise to the amniotic sac. Now, if fertilization does not happen after about 2 to 3 days or so, and then implant within another 4 days, so by day 7, if it doesn't get implanted, then by day 28, the entire lining of the uterus will slough off and she'll have her period. That concludes our lesson. Make sure that you arrange your labels neatly so that way everything can be seen. You should also have included all of the descriptions. Now mine don't have descriptions. All the descriptions are within the lesson, so I just have the labels, but you should have descriptions with them as well. So just make sure that you've arranged it. Before you finish up, you're going to include an additional label. This is where you're going to put your name on that label. Before you end your session, you want to make sure that you save your work on the bottom right-hand corner. Hit the save, and then you'll change the name. You'll begin with your last name, followed by an underscore and the title that should already be there.